Happening tomorrow is a day of awareness for heart health. It's American Heart Month, and heart disease is one of the leading causes of death for Americans. More than 650,000 people die each year of heart disease.
Through research and innovation, we've made considerable progress in recent years to advance the knowledge and treatment of heart disease. And joining us now to talk about heart health is Dr. Joseph McGinn, Chief of Cardiac Surgery at Baptist Health's Miami Cardiac and Vascular Institute. Doctor, thank you so much for being with us tonight. A big topic right now, women and heart disease. Tell us about the new programs and the risk factors specifically for women.
Yeah, well, that's a good question. A lot of people don't really realize that women are just as at risk for cardiac disease as men are. It happens a little bit less later in life, after menopause, typically for women, but it is just as important. One of the key factors is that women tolerate pain a lot better than men do, I must say. And sometimes they just blow off some pain as being something insignificant, and when in reality, it could be a serious cardiac problem. So we encourage all women to really focus carefully on the symptoms because it could be something serious.
You want to mention some of the symptoms, doctor?
Sure. Now, this is one of the weird things about the heart. The symptoms come in very different ways. The symptoms could be as simple and as commonly as chest pain, usually chest pressure, but it could also be shoulder pain. I've had patients who had jaw pain and even back pain. And so many people already have back pain. So very frequently it goes underdiagnosed or misdiagnosed because it was thought to be just routine back pain. So the message is be on the careful side, get yourself checked if you have any questions whatsoever.
Of course, we all know the pandemic has been life-changing in so many ways for respiratory health, for mental health, but how has it impacted heart health?
You know what? It's kind of a tough situation because the hospitals have been so filled with COVID patients that procedures that we typically would do electively, such as bypass surgery or stents or valve replacement surgery, those have all been put on hold because of all the beds being occupied by COVID. Thank God it's lightening up and we're back to a normal schedule and we're taking care of patients the way we should be taking care of them. So this is a great view of the future. We're happy to get back into normal activity levels, and the patients that have COVID have been decreasing over the last couple of weeks.
Well, yeah, we're all happy to hear that. Give us some tips on what people can do to protect their heart health. I mean, I can think of one off the top of my head. When you see those French fries, just stay away, go to the salad bar and don't use those thick dressings. But what are some of the other tips that would be helpful for folks out there?
Well, I talk about this all the time, and I know I'm a broken record about this, but eating the right foods is key. There's no question. That's probably the biggest thing we do. But there are other things. Exercise. If you're a smoker, stop smoking. If you have high blood pressure, control that as best you can. Diabetics need to be in tight control of their blood sugar. It's really important. And the last thing, and one of the very important things, is if you have a high cholesterol, you probably need to be on a statin and lower that cholesterol down as low as you can. I know this is stuff that we've always talked about, but they're really important, and these could lead you to a normal life. They could actually reverse some coronary disease and cardiac disease. So really important to follow these guidelines.
Yeah, when you look at the number of deaths every year from heart disease, you're so right, it is important. Dr. Joseph McGinn with Baptist Health, thank you so much for shedding light on how we can all be healthier for our heart's sake.
So tomorrow, be sure to put on some red and help raise awareness about heart disease. We'll be right back.